Hi gals, so today we're going to talk about common breast problems and who should get a mammogram. Hi gals, so the very most common reason to get a mammogram is if you are the age of 40 or older. There are a lot of different groups like the American Cancer Society or the American College of OBGYN, or different people recommend starting screening at different ages, but the most common is at age 40. So if you are 40 years or older, you should definitely start getting your breast cancer screening with a mammogram. And then again, there's some variants, like some people recommend checking once a year and some people recommend checking every 2 years, and a lot of it has to do if there's any personal history of cancer or family history of breast cancer. And sometimes some women would need to get ultrasounds or mammograms even younger than age 40. So if you have tested positive for those genes that are linked to breast cancer, you might need to start in your 20s or your 30s. So if you're not really sure when to start, see your OBGYN and find out. So very important to clarify is what a mammogram is. So basically a mammogram is an x-ray of both breasts, and the way that they're able to see at all of the tissue in this breast is by squeezing the breast in a device, and then they take the photo or an x-ray. It has minimal radiation, kind of like the same as when your dentist does an x-ray on your teeth. And because the breasts are kind of pressed together or squeezed, it could be uncomfortable or painful. So some women, we recommend for some women to take Tylenol or Motrin before they have this study done. It doesn't take that long, so that's what's good about it. And a lot of times if you're younger, like in your 30s or 20s, besides doing the mammogram or the x-rays, an ultrasound would be of benefit, just so that we can see any tissue that might have fluid collections. And also biopsy of the breast is where with an ultrasound they'll find the location that they want to biopsy, and a tiny needle gets passed through the skin and then a biopsy is taken. So it's called a fine needle aspiration or a biopsy. So another reason to get a mammogram is if you felt a breast lump. If you feel a little a lump is like a little mass or a little piece of tissue that's hardened on your breast that wasn't there before. A lot of times younger women tend to have breasts that are very dense, or the tissue is just very tight, so it's difficult to detect these masses. You should be getting an annual clinical exam by your doctor, and then you guys can differentiate if you need any further workup or not. If you notice something new or different, definitely go see your doctor so your doctor can feel it and check it and see if you need a mammogram or not, or an ultrasound or something else. So another very common complaint is to have breast tenderness. So there's different types of breast pain or tenderness. So one type is the one that is generalized, and it just hurts all over your breast on both sides, and it tends to happen right around your period or when you're about to get your period. So this is cyclical hormonal breast pain, and there's some type of pain that doesn't relate to your menstrual cycle, and it could just be there all the time. A lot of this pain can be caused by muscular pain, or maybe you bumped into something you don't remember, or it could be chest pain, or it could be heartburn type of pain. When it's very localized type of pain, it could also just be something on your skin. Most of the time, breast pain or tenderness is not something that is caused by cancer, and you can take some Tylenol, see if it helps with the pain. Definitely, if you're concerned, you have to go see your doctor to find out if you need further tests. Another common complaint is to have discharge on your breast, and the very most common cause of having white milky discharge is, of course, due to pregnancy or right after having a baby, and it's just milk production from your breast. Also, some women, when they express, like if they're squeeze or try to squeeze out their nipples, they can get some brown or green or yellow tinged discharge, even sometimes some bloody discharge. Most of the time this again is not due to cancer if you're under 40. But definitely if you're having a discharge that you didn't have before and has not been evaluated by a doctor, you have to go see and make sure it's not something that needs to be further worked up. If it's a clear discharge and you're a little bit older than 40, you definitely want to make sure your doctor you tell your doctor about this, so you guys can get a mammogram, an ultrasound, or a biopsy if needed. Also commonly seen are inverted nipples. So if you've always had nipples that go inside, kind of like your belly button, like inverted, and that's always the way it's been, it's really not anything to worry about. It's just kind of like having blue eyes or having brown eyes. Sometimes after breastfeeding, some women, their inverted nipple will become everted, or it'll pop out, and that's fine. And on the other hand, if you've had everted nipples, like nipples that stick out and then they become inverted, that might be of concern. So make sure you tell your doctor, and you can find out just to make sure that there's nothing else going on there. And lastly, something that's also very common is to have skin changes around your breast. So of course, there's skin around your breast, so you can have any problems that you have anywhere else on your skin, like acne, or you can get a little rash or itching or scaling. Most of this is not anything of concern. There are other problems that arise and that show on the skin, like breast cancer or Paget's disease. So if it's something that is new to you and it's something that hasn't been evaluated by a doctor, you have to go and get seen and make sure it's not anything to worry about. So I hope this helps you guys. Subscribe to the channel, like us on Facebook, and follow us on Twitter, and I'll see you next week.